Hello, this is Dr. Grande. Today the question is, what is the difference between anorexia nervosa and bulimia nervosa? Now, both of these conditions are eating disorders, and they can be fairly easy to confuse with one another. And there's also a question I'll answer later about whether somebody can be diagnosed with both of these conditions at the same time. Let's start with anorexia nervosa. With this eating disorder, an individual restricts intake so that their body weight becomes lower than normal. They have a preoccupation with their body weight, with their body shape, and there's a real fear of weight gain. Now there's two subtypes with anorexia nervosa, a restricting type and a binge-eating purging type. And specifically with this binge-eating purging type, this is where there's a lot of confusion with bulimia. So the restricting type of anorexia nervosa is when somebody has intake that's insufficient to maintain normal weight. The binge-eating purging type is where somebody will binge eat, usually in a period of time, an hour or 2 hours. They'll eat a lot of food, and then they'll exhibit what are called compensatory behaviors. So this would be vomiting, misuse of laxatives, over-exercising, using diuretics, fasting, something to get that weight back down. So that sounds a lot like bulimia nervosa, and as I mentioned, I think that's why these two disorders are confused with one another quite a bit. Also with anorexia nervosa, we have a severity specifier, and we have it with bulimia nervosa as well. And the severity specifier for anorexia is based on the BMI. And the severities go from mild to moderate to severe, and then all the way to extreme. So there's 4 severity specifiers with anorexia. Now let's look at bulimia. With bulimia, an individual has that binge-eating purging cycle. So there are periods where individual overeats, they eat a lot of food, usually in a discrete time period, like a couple hours, and then they exhibit the compensatory behaviors. So the ones I mentioned with anorexia nervosa, vomiting, misuse of laxatives, excessive exercise. So those compensatory behaviors are used shortly after this episode of binge eating. With bulimia nervosa, there are 4 severity specifiers, just as is the case with anorexia nervosa. But rather with anorexia, you have the BMI being the basis for the severity. With bulimia, it's the number of times we see the compensatory behaviors. So there's this episode of binge eating, and afterward, these compensatory behaviors. It's the number of times we see those behaviors that determines the severity, all the way from mild to extreme, just as we see with anorexia nervosa. It goes mild, moderate, severe, and extreme. For mild, it's 1 to 3 episodes of these compensatory behaviors, and then we move all the way up to extreme, it's 14 or more, all within 1 week. So with all the severity specifiers, it's how many times we see the compensatory behaviors in 1 week. One thing about bulimia that I think makes it a little easier to determine if it's actually bulimia or anorexia is that somebody with bulimia does have a normal weight. They maintain a normal weight. Somebody with anorexia, by definition, does not. So what can happen here with anorexia and bulimia is that somebody can have a diagnosis of anorexia nervosa, but then their weight can move back into normal range, where they only really have the binge-eating purging cycle left, and the diagnosis may change over to bulimia. Not necessarily, but it may. The same thing could happen with bulimia being changed over to anorexia. Somebody could have met the diagnostic criteria for bulimia, but then start showing more symptoms of anorexia, and if they still held on to that binge-eating purging cycle, the diagnosis would typically be anorexia nervosa, binge eating purging type. So to answer the second question, Can someone have a diagnosis of anorexia and bulimia at the same time? Well, technically no. Technically only one diagnosis can be in place because anorexia has a weight level below normal and bulimia has a normal weight level. And I realize there's a lot of confusion over this, and certainly some clinicians may diagnose both. They may understand the definitions to be a little different than, say, I would. But as I look at the DSM, the Diagnostic and Statistical Manual, and as I look at how we classify these disorders, I would say, in my opinion, the answer is no. You can only have one diagnosis or the other. Both conditions, both disorders, can have very severe consequences, and they're both serious. But I tend to think of anorexia nervosa as a more serious and more severe eating disorder than bulimia, because it has that low weight component to it, and bulimia does not. Again, anorexia nervosa and bulimia nervosa are both serious mental health disorders that necessitate mental health treatment and medical treatment. And it's not unusual that we see a lot of positive outcomes from the treatment of these eating disorders. I hope you found this description of anorexia nervosa and bulimia nervosa to be interesting. Thanks for watching.